If you're having some neck and back issues and you're thinking, only choice that I have is to have surgery done, don't. Not until you talk to this young lady, Dr. Sonia Spencer with Spencer Chiropractic here on Pass Road in Gulfport. Always a pleasure.
Always a pleasure to see you too, Jim. And this is my passion, helping people avoid surgery. It's why I come to work every day. And one of the things I want to tell you is that 20 to 30% of all low back surgeries are reported to be unsuccessful in the short term, and long term, it's 50%.
Really?
So in the long term, over 50% of back surgeries are going to fail. And so we always say go from most conservative to most invasive. So chiropractic is the most conservative thing that you can do for your neck and back.
Mm-hmm.
And, you know, I will get your MRIs, I will look at them and tell you if I've been successful with a case like yours. So one of the reasons why back surgery fails so much is because there's so many things wrong on that MRI, and they just go for the big juicy thing, but that might not be the pain generator.
Never heard it that way.
Yes. So if you have 5 or 6 things wrong on your MRI, and you know you have one big herniation, and they go in and they do that surgery on that herniation, that may not be the thing that was causing it. Maybe one of those other little small things. That's why you need to have an exam to correlate to your MRI
Mm-hmm.
and see exactly what's causing, you know, that particular pain in your body. So there's really some non-invasive things we can do, you know, not using drugs, not using shots, not using surgery to help a person heal.
Mm-hmm.
So let's talk about the number one reason why a person would go have back surgery.
Okay.
And that's because of excruciating pain in the leg. This pain, you know, can be so intense because it affects the largest nerves in your body, and it can be so intense and so painful and so scary to a person, you know, that they go ahead and go for the surgery because, you know, at the time it's killing them,
Mm-hmm.
you know. And so I'm not opposed to people taking medication while they get less invasive treatment, but I want to show you something really neat. You see this little bubble right here on the tire?
Yeah.
All right, that's a disc herniation. We have a treatment called spinal decompression where it just gently opens it up off of that nerve and allows the disc to heal non-invasively. We have a machine that does this, our decompression machine called SpineMed. You can look it up on our website or on the internet. But spinal decompression is very effective at healing herniations and helping the nerve pressure come off that's affecting those legs
Mm-hmm.
down there. And the same thing is true in your neck. You know, you can have disc herniations in your neck that affect your arms. Most of my patients who come in who do spinal decompression are having the kind of pain that's coming out of their neck, going
Mm-hmm.
down in their arm. And they may have already had one back surgery. And in fact, just this morning I had a patient who's had one surgery and they're contemplating number 2. Yeah.
And you
yeah.
kind of cringe when you hear that, don't
kind
you?
of cringe because I have patients who've had up to 8 spinal surgeries. And knowing that failure rate is 50% in the long run, you know, really makes a person want to explore other options, especially if they want to have the quality of life,
Mm-hmm.
you know, when they get older. You know, I don't know about you, but I want to be able to dress myself, wipe myself, bathe myself, and do everything for myself.
Yes.
Yes. So when you can't even get out of the chair because, you know, your whole back is fused and everything is turning to mush back there, it's really hard to have a quality of life. And this is why I'm so passionate about, you know, helping people avoid spinal surgery, because I know back pain, especially post-surgical back pain, is a major source of disability. And I'm not talking about money disability. I'm
Mm-hmm.
talking about not being able to get up and do your daily stuff.
Mm-hmm.
You know, it really affects people. So it hurts my heart to see people who didn't try conservative things first, and they went on in having the surgery thinking it was the only option for them, and didn't even try chiropractic or physical therapy or less invasive things, and just to see them suffer so much.
Right.
Yeah. And I will say this, close to 50% of my practice has had a back surgery.
Really?
It's epidemic in the United States. The United States does more back surgeries than any other country.
Well, they
in the
just find
world.
it as an easy way out? I mean, the physicians or surgeons or whatever
I
saying,
don't know, but I was seeing on WLOX that there was a financial component. Y'all have a show that's coming on Sunday nights. There's some kind of financial component when they put in some hardware, and they were given an in-depth report on that. So I don't really know that side of it. I can just tell you that if you've been told that you have to have spinal surgery, why don't you try chiropractic? What have you got to lose? It's the safest form of treatment that there is.
non-invasive.
Non-invasive.
That's the biggest thing.
Yeah, and it's safer than taking an aspirin. And how many times have people done that in their lifetime? It's very safe to get chiropractic care, and we're well equipped to look at your MRIs and disc herniations, and see if we feel like our approach would help.
Would help you out, yeah, definitely. And again, it's less invasive. A lot of people think, well, I can mask it with getting on medications, pain meds or something like that. And that's all you're doing is you're masking it.
Yeah,
You're not fixing the problem.
A lot of the medications that they're giving for leg pain really affect your balance and your mental and your brain. So that's not what the elderly always need, is a medication affecting their balance and their ability to think. So the number one medication we're seeing right now for nerve pain has that side effect. Look it up.
Okay, and we're not going to even mention what it is.
Yeah.
Can't do that. But, I guess as far as the back pain, it could feel like something simple. Could become from having an accident or something like that. And the longer you prolong getting some treatment for it, it's going to get a lot worse.
Yeah, it typically does. And a person can progress into chronic lower back pain. But, it's easier to get this stuff fixed when you're younger. And so many of my elderly patients said, I wish I would have done this sooner instead of waiting so long.
Wow, I mean, that's amazing. And again, another one of the great treatments that y'all do here at Spencer Chiropractic. And we've seen so many of them that y'all have done over the years that we've been here for the entire body.
Yeah,
the entire
head to
body.
toe.
Head to toe. Well, as you can see, all the little buttons here, head to toe. You just there's everything that you can get. And of course, if you want help with some treatment, you can set up an appointment. Just call the office here. They're located on Pass Road in Gulfport, right across from Pass Road Elementary.
That's right.
And set up an appointment. You're open Monday through Thursday?
Monday, Tuesday, Thursday.
Monday, Tuesday, Thursday. Okay, so if you want to get some kind of treatment, if you're having some back issues or something like that, and you need to get something taken care of from down there, what you need to do is call and set up an appointment, again, with Spencer Chiropractic here. They're located on Pass Road in Gulfport, across from Pass Road Elementary. Get that relief that you need from Spencer Chiropractic.